Hi, my name is Jada Moore-Ruffin, and I'm a family physician. And we are at Whitefoord Community Program at Coan Middle School Student Health Center. The focus and the mission, this organization, Whitefoord Community Program, was started over 15 years ago with a resident, then a pediatric resident, and the chairman of the pediatric department at Emory, Dr. George Bromley, was the pediatric chair, and Vida Johnson was one of the founders of the program. She later continued with the program as the medical director for 14 years. The focus and the mission really was to assist the neighborhood in areas that were critical to prosperity, to the neighborhood thriving, to its families having access to the many things that they needed, not only for themselves but also for their children. So somewhat of a community or neighborhood redevelopment, if you will. At the time, there were many challenges for this neighborhood as an inner city neighborhood, and many of those you can imagine. So the focus was to really get in early to meet the needs of the students, to assist the families in any way possible, to really get at the core of the things that needed to happen in order for the families to thrive. So with that said, for the school-based health centers, which is the only one at that time and even now, the only school-based health center in the state, was to bridge the gap between academics and health, or poor health, if you will. So we wanted to, or they wanted to, the focus was to have children have everything they needed to be successful in school. So out of that came the health center, which was, the first one was at Whitefoord Elementary School and is still there today. Several years later, Coan Middle School, which is where we are today, and most recently, last year, Toomer Elementary School became one of our sites that we provide limited services with our dental services and medical, not as full service as the elementary and middle school locations. And now we have recently launched a project to open a school-based health center at Crim Open Campus High School off Memorial Drive. So we're really excited to have a program at each level, the elementary, the middle, and the high school. It is perfect because we get to follow many of the students throughout their life cycles or lifespans. And we also get to engage at several levels of the educational process for us in terms of risk reduction and prevention. Certainly the earlier the better. And Dr. Johnson and Dr. Bromley knew that. And that out of that was the inception of the Early Childhood Development Program, which is also one of the Whitefoord Community Program assets. So that program is for infants all the way through pre-K4, and most recently our pre-K4 program in this school year actually moved over to Whitefoord Elementary School, so they're actually getting a little bit of the school environment. So it really, that piece of it was really important for starting earlier with recognizing or identifying specific needs. So the earlier that we could address those, the more successful that those students could become. In addition to that, an after-school program was started. So now we have something for the small kids, we have something for all age levels. The after-school program was really critical in that we wanted to be able to help students with additional academic resources, as well as fun outlets and safe places to go in the afternoon, many of them until they were able to go home with their parents.
Talk about the staff that is at the center here and what services you provide specifically.
Okay, we are a comprehensive program that many school-based health centers have that model. The critical pieces for us are the medical services, where we see acute cases of just sick visits. So if there's a kid with a sore throat or having an asthma attack or a rash, or they've had an injury throughout the school day or even off campus, then we see those students for acute visits. But we also do chronic care. We do immunizations. We do health checks. We do preventive services. So we do a variety of things from the medical piece. The other thing that we do, we have dental services. So we have a full-time dentist and dental assistant. And we love that because the students can get their medical care and their dental care all under one roof. And if that isn't enough, we have included the social piece where we're able to provide, evaluate, and do referral services as needed for behavioral or mental health concerns. So our program works because we're looking at what ways can we support the child and ultimately the family to help to meet their needs and get them closer to academic success and personal success.
I was wondering if you could expand on that. How does a healthy child and a child who has easier access to health services become a better student?
Well, think about it. As an adult, when you feel well, you perform well at work. School is their job. If they come to school and they don't feel well, they have a headache or a toothache or tummy pain, or maybe if there's something going on that's concerning them emotionally and they're not able to focus, they're not able to stay clear. If they have a nagging cough because they or if their asthma's bothering them and they're not breathing as well as they could, they can't participate in activities that day or join sports teams or it really runs the whole gamut, and very much like an adult that doesn't feel well, you can't perform at your best. If a kid is not feeling well, that's a barrier for them. And each day matters, each day counts. They happen to have a test that day, or if they're preparing for something big, or they're going over some really challenging concepts. And if they're already challenged and then they don't feel well, or there's something emotionally tugging at them, it's a distraction.
Looking forward, you're going to be opening a center at Crim. How do you look into the future? When you look into the future, what do you see in terms of the benefits of this program moving forward?
The benefits, I think, are to really meet kids as they go into another stage of life and they actually start to approach adulthood. The adolescent age is really interesting because they are ready to be independent, to function independently, to make their own decisions, to live their life. They have a lot of things that are tugging at them, that are pulling at them, and a lot of decisions to make that when you're a child, you have a little bit of room or a little bit of leeway. But as they move into adulthood, these decisions become very, very critical and sometimes irreversible. So I think it's important to really get that last opportunity in a group environment, a group setting, to educate them, to do screenings, to help to evaluate them physically, emotionally.
Well, thank you so much for taking the time, and good luck with the center the rest of the way.
Thank you.